Today's topic is rabies. Basically, rabies is a virus that is usually spread by the bite or scratch of warm blooded animals, dogs, cats, jackals, and wolves. By the time the symptoms appear, it is generally too late to save the patients. These are the category animals who generally transmit rabies. It's a viral disease that is nearly always transmitted by an infected animal bite or licks. Rabies is most common in countries where stray dogs are present in large numbers, especially in Asia and Africa. It is passed on through saliva. Rabies can develop if a person receives a bite from an infected animal or if saliva from an infected animal gets into an open wound or through a mucous membrane such as the eyes or mouth. It can pass through unbroken skin also. It cannot pass through unbroken skin. Rabies is also known as hydrophobia. पानी से बहुत डर लगता है. It's a highly fatal disease of warm-blooded animals, particularly carnivores such as dogs, cats, jackals, wolves, etc. It is clinically characterized by a long and variable incubation period, a short period of illness due to acute encephalitis, ending in death despite intensive care. Death is certain. It is the only communicable disease which causes 100% mortality. That's why it has become very, very important disease to understand and know about it. Geographical distribution. Rabies has been found in almost all countries except Australia, British Isles, New Zealand, Japan, Hawaii, and much of Scandinavian countries. Rabies-free countries are those where no case of indigenous rabies has taken place. Basically, it is an endemic disease in Libya with occasional cases of rabies. As far as incidence is concerned, reliable data on rabies are scarce in many areas of the globe, making it difficult to assess its full impact on human and animal health. The annual number of deaths worldwide caused by rabies is estimated to be between 40,000 and as high as 70,000 if higher case estimates are used for densely populated countries in Africa and Asia, where rabies is endemic. An estimated 10 million people receive post-exposure treatment each year after being exposed to rabies suspect animals. It occurs in 150 countries. Carnivore bats also act as a natural reservoir, but rabid dog is the sole animal causing human infection. As far as trend is concerned, dramatic decrease in human cases of rabies have been reported during recent years in China, Thailand, Sri Lanka, and Latin America, following implementation of programs for improved post-exposure treatment of humans and the vaccination of dogs. Since 1990, rabies in wildlife also has been eliminated in some Western European countries. They have conducted oral vaccination campaigns, basically capsules mixed with certain eatables are thrown inside the forest as and when these wild animals eat these particular things, they get the vaccination done. And that's the reason it has been eliminated in most of the European countries as wildlife is concerned. Libyan situation, it's a very rare human disease in Libya in spite of abundance of stray dogs. Now, as far as agent of this particular disease is concerned, the agent factors are it is a neurotropic virus. It occurs in the highest concentration in the CNS and salivary glands of the rabid animal. The virus recovered from naturally occurring cases of rabies is called street virus. It requires 12 to 25 days for this virus to produce rabies in rabbits. When the street virus is passed successively through a large series of rabbits, the virus is altered in such a way that it produces rabies in a much shorter time, that is 5 to 6 days. Now, virus isolated at this stage from the rabbits is called a fixed virus. And this fixed virus is used for the preparation of vaccines. Very important thing to understand. That fixed virus, whose antigenicity is maintained, pathogenicity is reduced, incubation period has become very shorter, is used for preparation of vaccines. Now, who is the reservoir of infection? Rabies exists in almost all epidemiological forms. Urban rabies, the urban cycle is maintained by the stray dogs, which is responsible for 99% of cases. As far as fixed virus, which we were talking about, it's a virulent in human being, but virulent in lab animals. It has lost pathogenicity for human, but retains antigenicity. Cannot produce negative bodies in neurons, lost power of invasion and multiplication. Incubation period in lamb animals is reduced to 5 to 6 days. That is almost fixed. And this is the virus which is used for preparation of vaccines. That is the importance of fixed virus. Basically, rabies, if you see from this diagram, it is a brain inflammation. But virus is transmitted by infected saliva through bite of wound. That is the normal phenomena. Now, as far as life or children rabies is concerned, this cycle is perpetuated by wild carnivores such as jackal, hyena, fox, and wolf in the jungle. In South Africa, the disease is endemic in yellow mongoose. These wild animals transmit the infection to domestic animals whenever they cross the areas. Man may occasionally contract rabies from this cycle. In certain Latin American countries, the bat has also been found to be the reservoir of infection. They attack man and animals and transmit the disease. Now, as far as source of infection is concerned, the source of infection to man is saliva of a rabid animals. The saliva may be infective 6 days before the onset of clinical symptoms and during the course of illness till death. These were the agent factors. Now, as far as host factors are concerned, all warm-blooded animals are susceptible to rabies. Rabies is a dead-end infection in man as there is no survival value. That is the dreadedness of this particular disease. Now, as far as reservoir is concerned, the North American most documented human rabies death occurred as a result of infection from the silver-haired bat rabies virus variant. In contrast, in most countries of Africa, Asia, and Latin America, dogs continue to be the main host and are responsible for most of the human rabies deaths that occur worldwide. The most frequent way that human being infected with rabies in India is through the bite of an infected dog, cats, wild carnivorous species like foxes, raccoons, skunks, jackal, wolves, and insectivorous and vampire bats. Cattle, horses, deer, and other herbivores can become infected with rabies, and although they get rabies, cannot transmit the virus to other animals and men. This is what is seen in India. Mode of transmission, if we want to know about how it is transmitted from one to another, basically it is the bites. As a rule, rabies is transmitted to man by the bite of a rabid animal. The virus is inoculated into the skin. Licks on abraded skin, scratches on mucosa can also transmit the disease. As far as incubation period of the disease is concerned, In communities, it is 1 to 3 months, but may vary from 10 days up to 1 year or longer. The incubation period depends upon the site of the bite, severity of the bite, amount of virus injected, and species of the biting animal, protection provided by clothing, and treatment undertaken, if any. So these are the factors which decide incubation period. In general, incubation period tends to be shorter in severe exposure and bite on face, head, and upper extremities, and bites by the wild animals. In other words, specific communicable disease is the incubation period is so variable and dependent on so many factors. When we talk of rabies in man, the disease begins with headache, slight fever, and malaise. There may be twitching, pain, and numbness at the site of the bite. Soon the patient shows typical symptoms and signs such as intolerance to noise and bright light, difficulty in swallowing, fear of water, increased reflexes, and convulsions. Death occurs due to respiratory paralysis. The duration of illness is usually generally 2 to 10 days. The disease always ends in death. When we talk of rabies in dogs, the incubation in dogs may vary from 10 days to 8 months or even longer. Dumb and furious forms of rabies have been described. Rabies in dogs may be detected by the following symptoms: change in normal behavior, कैसा होगा ये? Easy irritability, tendency to attack and bite without provocation, biting unusual objects like sticks, running amok, a tendency to run away from the home, wander aimlessly, and biting anything that comes in its way. Change in voice, the dog barks in a hoarse manner. Gasping for breath is another sign which we can see. Now let's see the prodromal symptoms among human beings. Early flu-like symptoms, fever, headache, anxiety, feeling generally unwell, sore throat and cough, nausea and vomiting. Discomfort may occur at the site of the bite. Suddenly, then it gets converted into acute neurological period and symptoms. Neurologic symptoms develop confusion and aggression among the patients, partial paralysis and rigid neck muscles, convulsions, hyperventilation and difficulty breathing, hypersalivation or producing a lot of saliva and possibly frothing from the mouth, fear of water or hydrophobia due to difficulty swallowing, hallucinations, nightmare, insomnia, priapism, photophobia or fear of light. This is frothing from the patient's mouth. This is child is very anxious and having fear of water, that is hydrophobia. Now, question comes in how to go for management, how to manage the patient. First of all, diagnosis. History of the bite by an animal is suggestive. Sensory system. Intolerance to bright light, noise, and cold or drought of air or aerophobia is pathognomic. Motor system. Increased reflexes and muscle spasm develops. Nervous system में perspiration होगा patient, salivation, lacrimation, dilatation of pupils, anger, irritability, depression, and he always has a fear of death. These are the symptoms. What to do then? Go for virus isolation from saliva and other secretions. Neutralizing antibodies detectable in serum and CSF usually after 10 days, but not reliable and not used. Treatment, as far as treatment is concerned, there is no treatment available. Prevention is the only cure. What we'll do? Now, prevention of human rabies can be done in three aspects: post-exposure prophylaxis, pre-exposure prophylaxis, and post-exposure treatment in case of vaccinated previously. So how do we go for prevention of human rabies? General consideration in rabies post-exposure treatment are WHO strongly advocates the use of modern purified products prepared on cell culture. Modern vaccines for purified embryo cell culture that comply with WHO criteria for potency, innocuity, and have been assessed satisfactorily in humans in well-designated field trials. WHO supports the trend to abandon completely the production of brain tissue vaccine. So, what do we do? Immediate washing or flushing and disinfection of the wound, rapid administration of purified immunoglobulins and modern vaccine are the basic modalities described in the guidelines below. Now, vaccine against rabies are nervous tissue vaccine derived from adult animal nervous tissue, derived from suckling mouse brain, the embryo vaccines, DEV, cell culture vaccine, human diploid cell, second generation tissue culture vaccines. Rabies post-exposure treatment is an emergency. Wound should be treated immediately. Vaccine and serum therapy instituted as soon as possible. Initiation of treatment should not await the result of laboratory diagnosis. If delayed by dog observations when rabies is suspected. Pregnancy and infancy are never contraindications to rabies post-exposure treatment. So, persons who are for evaluation and treatment, even having been bitten by, dealt in the same manner if the contact have occurred recently. पुराने patients आ जाएं चाहे नए patients आ जाएं, treatment, progress and treatment procedure will remain same. Definition of categories of exposure and use of rabies biologicals कैसे depend करता है? कैटेगरी 3 सिंगल और मल्टीपल ट्रांसडर्मल बाइट्स जिसमें से खून निकल रहा हो, स्क्रैचेस और कंटामिनेशन ऑफ म्यूकस मेम्ब्रेन विद सलाइन. इन केसेस में क्या करना है हमें? यूज इम्यूनोग्लोबुलिन्स प्लस वैक्सीन. कैटेगरी 2 माइनर स्क्रैचेस और एब्रेजन्स विदाउट ब्लीडिंग, licks on broken skin. Very important word is broken skin. Nibbling of uncovered skin. यहाँ पर हमको वैक्सीन यूज करनी ही करनी है. यूज वैक्सीन क्योंकि यहाँ ब्लीडिंग वगैरह नहीं है या इस टाइप से कुछ नहीं है, तो हो सकता है हमें इम्यूनोग्लोबुलिन यूज करने की जरूरत नहीं पड़ती है इसमें. सो क्लास 2 बाइट्स में ऐसा है. क्लास 1 बाइट टचिंग, फीडिंग एनिमल, लिक्स ऑन इंटैक्ट स्किन, नो एक्सपोजर. बेसिकली एक्सपोजर हुआ ही नहीं है, सिर्फ उसने लीक किया है जो भी किया है. नो ट्रीटमेंट ऑफ हिस्ट्री ऑफ really there is no history of any wound or scratches there. Not it. You can just wash the wound and keep it so clean. That's all. How to go for wound treatment? Should be immediate. Is essential even if the person presents long after exposure. भैया साफ तो करना पड़ेगा. Immediately wash it. Consist of immediate washing and flushing with soap and water alone for 15 minutes, nothing less than that. And then disinfecting the wound with ethanol. Remove virus from the site. The photograph shows how it is done. Wash with plenty of soap and running water under a tap for 15 minutes. Automatically it will be washed off. It is the most important step in the treatment of a dog bite as it decreases the chances of developing rabies by 80%. Very, very important step. Rabies post-exposure treatment, intramuscular regimens. There are two intramuscular schedules for modern vaccines. Vaccine should not be injected in the gluteal region, that should be kept in mind. The first is classical 5 dose intramuscular regime, that is SN regime, SN regime. What happens? One dose of vaccine should be administered on days 0, 3, 7, 14, and 28 in deltoid region or in small children into the anterolateral area of the thigh muscles. As an alternative, the 2-1-1 regime may also be used. Two doses are given on 0 day and then one dose each. Deltoid muscle, right and left arm, anything can be used, right? So this is how it is done. This is graphical presentation of the same thing. Administration of rabies immunoglobulins. A class 3 bite है तो rabies immunoglobulins लगाना पड़ेगा. Infiltrate into the depth of the wound and around the wound. As much as anatomical, physical, feasible of the rabies immunoglobulin should be infiltrated around the wound. Any reminder should be injected at any intramuscular site distant from that of vaccine inoculation or into the anterior thigh. Quantities oblique volume of rabies immunoglobulins in the dose of 20 international units per kg for human rabies immunoglobulins or in the dose of 40 international units per kg of equine rabies immunoglobulins. Now this is the dose schedule form which should be used. 20 in case of human, 40 in case of equine. The total recommended dose should not be exceeded. Very, very important thing. If the calculated dose is insufficient to infiltrate all wounds, sterile saline may be used to dilute it 2 to 3 fold to permit thorough infiltration. But dose increase nahi hoga. Dose will remain same, it can be diluted. Non-specific care, postpone suturing if possible. If suturing necessary, then IRIG has been applied locally, it should be ensured. Apply antimicrobials and tetanus toxoid. Now this is rabies immunoglobulins, equirab and human rabies immunoglobulins shown in this particular thing. Dose for HRIG, as I said, 20 international unit per kg body weight divided doses, half of the site of the wound, intradermal oblique subcutaneous, since it is painful. Other half intramuscular in case required. General consideration on intradermal rabies post exposure. अभी तक हम इंट्रामस्कुलर की बात कर रहे थे. Now we go for intradermal. As these regimes require considerably less vaccine than the intramuscular regime, the matter is particularly appropriate when vaccine or money is in short supply. पैसा कम है या वैक्सीन नहीं मिल रही, then this method should be used. Intradermal injections reduce the volume of vaccine required and vaccine cost by 60 to 80%. What is? It is very, very important. Recommended intradermal regimes and vaccines for use by the intradermal route are: number one is 8-site intradermal method, 804011 for use with human diploid cell vaccine, 0.1 ml per intradermal site. The 8-site regime should be particularly considered in emergency situation when no rabies immunoglobulin is available. So multiple coverage, multiple point coverage is the basic aim, right? 2-site intradermal, one method, 222011. The volume per intradermal site is 0.1 ml. This is the schedule shown 07, 28, 90. पहले दिन आप 8 अलग अलग जगह पर दे दो, फिर छोड़ दो. उसके बाद 7th day at 4 different places. After 28 days at one point and after 98 days at one point. So we are basically having 2 vials and 4 visits. टू साइड इंट्राडर्मल रेजिम में आपने 0372890 का शेड्यूल रखा, 222221 करके आपने 2 वायल बट 5 विजिट्स में उसको खत्म किया. So this all depends how much rabies is available and how much time is available with the individuals. But minimum 4 visits are always there. So this is to be kept in mind. Now, if the person is previously vaccinated, what do we do? Rabies post-exposure treatment of previously vaccinated person. लोकल ट्रीटमेंट अब उन तो करना ही करना है. वैक्सीनेशन शेड्यूल इस टाइप से रहेगा. 1 dose on day 0 and 3. The dose is either one standard intramuscular dose, that is 0.5 ml, or one intradermal dose of 0.1 ml per site. No RIG should be applied. Previously vaccinated है बंदा. However, full treatment should be given to this person who received pre and post exposure treatment. The vaccine quality is unproven. Potency, or who have not demonstrated almost rabies in neutralizing antibodies इसमें नहीं है, उनको full dose देना ही पड़ेगा. This is anti-tetanus administration. These are the category 3 type of wounds in figurative form. You can always see that. There is a deep bite, multiple wounds, bleeding is there, class 3 bite. Sutures, very important thing to understand. Preferably do not suture the wound. If necessary, suture it 24 to 48 hours later, applying minimum possible stitches as shown in the photograph here. This is package of Rabipur vaccine. If it is undocumented in the records, please take it as if it is if person is unimmunized. Use this vaccine for them. Now, pre-exposure rabies vaccination, important thing. Who require pre-exposure rabies vaccination? Group of person at high risk of exposure to live rabies virus. Who are they? Laboratory staff, veterinarians, animal handlers, and wildlife officers. And of course, toddlers and children in highly endemic areas should also be considered. Regime with vaccine fulfilling WHO criteria. 3 doses of vaccine on 0, 7, and 28 days should be given. Pre-exposure vaccination. A dose is either one standard 0.5 intramuscular or 0.1 ml intradermal. Alternative regimes are being tested for preventive vaccination of toddlers and children in highly endemic areas. Site of injection, adults, deltoid areas of the arm, children, anterolateral area of the thigh. What do we do for rabies in dogs? The incubation in dogs may vary from 10 days to 8 months as we have already seen. Dumb and furious forms of rabies have been described as far as dogs are concerned. Rabies in dogs may be detected by the following symptoms. We have seen it earlier. Change in normal behavior, running amok, change in voice, gasping breath. If it is seen, vaccination of dogs is a must. This is the schedule for vaccination of dogs. Various kind of vaccines are shown here. Now, if we talk in terms of rabies vaccine, it should be given in the first month, right? And after that, yearly revaccination, right? This is our first vaccination at 4 to 6 months. Receive a second booster at 1 year later, and typically vaccinated after 3 years. This is how the rabies vaccination timeline for pets goes on. These are the basically stickers which you should stick on to their vaccine register, vaccine diary, which is issued to the dogs by the veterinarians, should be maintained. Now, rabies in dogs manifests in two forms. Furious rabies is characterized by extreme behavioral change, including overt aggression and attack behavior. Second is paralytic rabies, also referred to as dumb rabies. It is characterized by weakness and loss of coordination, followed by paralysis. In prodromal symptoms among dogs, how do we recognize them? Dog will show only mild signs of CNS abnormalities. The stage may last for 1 to 3 days. Most dogs will then progress to either the furious stage or the paralytic stage, or a combination of the both, while others succumb to the infection without any major symptoms. Generally, symptoms among the dog, if we have pets at home, how do we recognize? Pica, eating, watching, eating, मिट्टी खाएगा दीवार पे ऐसे चाटेगा something like that. Fever, seizures, paralysis, hydrophobia, jaw is dropped, inability to swallow, change in tone of bark, suddenly hoarseness, muscular lack of coordination, he can't walk properly, ataxic walk, unusual shyness or aggression, unprovoked barking, excessive excitability, constant irritability, change in attitude and behavior, excessive salivation, that is hypersalivation or frothy saliva coming out of one of the sides of the mouth of the dog. So these are the things to be observed in a dog when we want to see whether the dog is having rabies or not. This is the classical picture of a dog having rabies. Diagnosis of rabies. The diagnosis of rabies in dogs is based on the clinical findings. If a dog has been exposed to rabies, following should be done. Quarantine the dog and contact the veterinarian immediately. If the vaccination history is available and if it is up to date, then one shot of rabies vaccination should be given and watch for 10 days. If the dog is unvaccinated, the rabies proves fatal and within 7 to 10 days the dog dies. The diagnosis is confirmed by the post-mortem diagnostic fluorescent antibody test. How to control the dog population? That is always a question in the towns and corporations. They don't kill the dog because killing the animal life is now prohibited. So we go for mass sterilization program. What do the mass sterilization program help? It basically reduces aggression among the dogs, decreases overpopulation, lowers the risk of the cancer among them, reduce roaming unnaturally, and of course, human behavior point of view से अगर देखें तो डॉग बाइट प्रिवेंशन वीक्स शुड बी ऑब्जर्व्ड एंड डॉग बाइट प्रिवेंशन में क्या क्या करना है डोंट टच ए डॉग unnecessarily ask the individual or the owner whether dog bites or not only take his permission then only do that. Don't touch unnecessarily, otherwise the dog will go for an unprovoked bite and you will be suffering. So better it is that stay away. And if at all you want to keep a dog, how pretty is this dog? Eh? How pretty is this dog? Take care. If you want, if you really take care, and if you want to have the joy of having pets, do enjoy that, but with full protection. Thank you very much.